Good morning, everyone. Lots going on as usual. I wanted to show you how our press reports things and how much difference a month makes, right? Here's the Globe and Mail reporting on March 12th, updated March 13th. Plenty of toilet paper to go around, Canada's biggest producer says. Remember back in March, those heady days of hoarding toilet paper because it was abundant? You could walk into an aisle. Actually, I was in Walmart the other day and the toilet paper aisle was restocked full. So it is what it is. However, fast forward to yesterday, and wood chips to make pulp for toilet paper in short supply, Commons Committee told, reported CTV News on the 17th. Today's the 18th. The Forest Producers Association of Canada says the demand for toilet paper has skyrocketed, increasing by 241% during the COVID-19 pandemic. Associated President Derek Nyber told the House of Commons Finance Committee today that the forest products industry has rarely enjoyed such a high profile. That's not just because it produces toilet paper, which Canadians began stockpiling as soon as it became clear early last month that orders to stay home were imminent. He says the sector is supplying the pulp needed to make sanitary wipes, paper towels, protective masks, and hospital gowns. And he says it's supplying the wood pellets, biofuels, and green energy that feeds heating systems and provincial power grids. Yet Nyber says 39 sawmills across the country have been forced to shut down due to the pandemic, and that has meant a reduction in the supply of wood chips that are needed to make pulp. And the story just kind of ends there. So I thought, usually there's some kind of conclusion. Maybe they just kind of mess that up, but maybe the editor should have caught that. It's been up for a day, or 12 hours anyway. So it's kind of a strange way to end things, right? He told them, and that's that. So weird, right? Here's Patty Haydu. No, that's not Patty Haydu. Miss Tam, Dr. Tam, telling Canadians, well, the question was, are you telling Canadians not to wear a mask because we have a shortage and we want to keep them for healthcare workers? And her answer is kind of long and meandering, talking about if you're sick, you should wear it to prevent spreading droplets. And then she gets to this point. So I just wanted to point this out. This is on March 30th. Okay, so this is less than a month ago. Again, it's April 18th. Here we
go. Putting a mask on an asymptomatic person is not beneficial, obviously, if you're not infected. If you're a close contact of a case and
I'll just leave that there. Fast forward to yesterday. And coronavirus, Global News is reporting air travelers required to wear non-medical masks under the new rules. So a couple of weeks ago, our top health officials are saying no masks, no need for masks, no need for anything like that. Don't worry about it. If you're asymptomatic, if you're symptomatic or you're around symptomatic people wear a mask. But if you're not, don't worry about it. And then here's the opinion. April 7th, Dr. Tam's about face on masks damages trust at a crucial time. And so this whole mask thing has evolved over the last couple of weeks, but isn't it interesting? We've gone from masks are absolutely not necessary to masks are absolutely necessary if you want to travel. So do masks work or no? Yes? Why would you tell Canadians? Why would you spend months telling Canadians that masks don't work? The same as why would you spend months telling Canadians that closing borders don't work? And then say, but we're going to close the border between the United States and Canada and you guys have to stay in your homes now. Ha ha, kidding. Right? Like what? How else could you spin this? And why do people continually, specifically the CBC and the bought mainstream media in Canada, why do they continually tell me that everybody's happy with the performance of this Liberal government? This has been an abysmal disaster. These people are absolutely, completely out of their depth. They do not know what they're doing. They're either making it up as they go along or finding the worst piece of advice possible and pushing that really hard until somebody can bludgeon them over the head with a slightly less worse piece of advice. It's incredible to watch in its absolute just failure after failure after failure. And people at the same time are celebrating these failures. It's incredible. Oh, we couldn't possibly have known. I mean, really? Okay, back to this. City TV News is reporting on February 17th, closing borders with China could make COVID-19 situation worse. Health Minister. So I'm just going to leave it at the headline. The link will be in the description. Yesterday, I was talking about looking at the numbers between the date of the border closures, the number of cases, number of dead, and and some people ask me to compare it to flu. That gets a little muddy. And I've got my references here. Usually I go through all my references, like for the dates of things and stuff, but that would just take absolutely forever. So we're just going to go through the numbers. Rest assured, I've gone through this, and I'll tell you about any kind of jinky stuff that I wasn't sure about, right? Like, so here's like February 1st, US and Australia closed the border to Chinese arrivals. So I'm using that as my reference for that in here for the border closing reference, right? And there'll be a link to this page. You can have a look for yourself to double check my numbers, see if I get anything wrong. And if I do, I'll make a correction, okay? So here we go. Taiwan closed their borders on January 24th. They have 398 cases, 6 dead, and 178 recovered. And I'm not sure. I'll show you this as well. Here is it's a Google tool. This is what I was using for my numbers. I didn't have it on the list here, but it's a Google tool, and it's got all the worldwide cases. So these are the numbers that I'm using. I don't know anything more official than this, and I understand what Google does. I know the "don't be evil" ended long ago, but they collate numbers from Wikipedia, and so that's to me as good as using the John Hopkins data. So I'm using this. Okay, so that's where that's from. So Taiwan, right? January 24th, they 6 dead, and they use masks. There's other things that are contributing to these low numbers as well. But I'm just looking at the date of the border closures to arrivals from infected areas, arrivals from China. Okay, Singapore, 5,992 cases, 11 dead, 708 recovered. 353 flu cases, 5.6 million population. Taiwan's got a 23.78 million population. Okay, 23 million people. Singapore's got 5.6 million, and they closed their borders January 31st. Thailand, March 23rd, they had 2,733 cases, 47 dead, 1,700 recovered, and I didn't get flu data from them. Population of 69,000. Okay, 69 million, not thousand, sorry. There should be an M there. February 1st, Australia closed their borders. They had 6,500 cases, roughly, 69 dead, and 3,819 recovered, with a population of 24 million and 600 flu cases. Japan closed the borders on March 5th, and they had 9,795 cases, 154 dead, 1,012 recovered, and 1,024 flu cases, with a population of 126 million people. South Korea, they tightened checks for all arrivals. I couldn't find one that said they straight up closed the borders, so they tightened checks for all arrivals. They have 10,000 cases, 232 dead, 7,937 recovered, 505 flu, with a population of 51 million. Russia has closed borders January 30th, has 36,000 cases, 36,793 cases, and a population of 144 million, 313 people dead, 3,057 recovered. The United States has a population of 328 million. They closed their borders to infected areas, not all of China, but infected areas, February 2nd. They have 712,000 cases, 32,000 dead, 59,000 recovered. And 26 million flu, but I couldn't get the flu numbers are a little bit. I'm not sure about the flu numbers. I went to the CDC and I saw weekly, and they said 26 million people sick with the flu, but I couldn't find those numbers. Anyway, regardless, the population is part of the reason. Like, the population number here is part of the reason this number is bad. But it's only twice the number of Russia, so I'm not sure what the United States is doing so much worse than Russia. Because it's not like the dates of the closure are that different, right? And Canada, on a population of 37.59 million people, have 31,000 cases, 31,927 cases, 1,310 dead, and 10,543 recovered, and 42,000 cases of the flu. That shocked me. And we still have not closed the border to China. There are people still arriving. I don't know if they're Canadian people from China. I don't know how anybody can make that claim. And I'm not claiming either that the only difference between all of these numbers is the date that the border was closed. There are, and I said it earlier, but I'll say it again, there are other contributing factors to this. But it bears the question, right? It bears the question, what are these people doing and why aren't we doing it too, right? And reading the up-to-date articles on Singapore, they've got things opened up and they're worried about a second wave or something like that. But that could just be the media, because going back to looking at the earlier articles on Singapore, they were worried it was going to turn out like Bay and everything was going to get shut down and blah, 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 blah. And that didn't end up happening, right? Like the numbers didn't bear out the press, the media frenzy. So I don't know. It's concerning to me that we have one of the lower populations on the list and one of the higher death rates. I mean, one of the highest death rates, second highest, right? So, and I mean, the United States is much worse. However, that's not good to be the highest among these peers, right? It's not like Japan has a much smaller population than us, or it's not like Taiwan is vastly different, right? Like, yeah, there are big differences. Canada is a much larger country with a couple of major cities that have their own, like BC's its own epicenter, Ontario's its own epicenter. So there's differences there, but you would think that would make containing things a little easier, right? Like it's separate, right? It's not like the one city's feeding into the other city, right? One Canadian city, like it's not like Toronto's feeding Edmonton's contagion, right? So not really, not in a direct way. But I mean, maybe it is. People are flying from Toronto to Edmonton, so that could happen too. These things are complicated. Anyway, it's interesting. It's interesting to look, and people said that they were interested. So I hope that satisfies your curiosity. It just makes me more curious to get better flu numbers. That's one. And more curious to get a better explanation as to how Taiwan kept their deaths so low and how we're not keeping our deaths so low, or how even Singapore or Thailand or Australia or even Japan, right, in this population level. Those are my questions. How did you guys do that? Is the answer masks? Is the answer masks? Because we are being told the only way to do this is to stay in your house completely. You cannot open up the stores. You can only shop at Amazon and Walmart and other big box stores that are open. Isn't that weird? Usually that would cause public distrust, right? You can only shop at the big box stores. But here we are, right? And the hero worship too. The hero worship is every day on Twitter, every day, everywhere. It's really, really, even they're buying ads on YouTube and buying ads on radio and stuff. And, stay home, stay healthy, wash your hands, clap for your healthcare workers. It's like, what? I keep thinking of V for Vendetta, the British guy and the big screen and the face in the big screen and do your duty and all that stuff. Man, it's very, very, the mirror that was reflecting the past is now projecting the future. And it's really, really odd to see those parallels, right? And to have people just enthusiastically embrace it. Right? And to have people like fight for it on Twitter. Oh my goodness, you're being evil. You're being mean by saying we should get back to work. We should get back to work. Right? Like there's no evidence that this is overwhelming us. There's no evidence that this is overwhelming. Well, I don't know. I don't know what this is, but it doesn't seem like it's what the media first sold it as. And I feel like we're going by the models still. And the models look really bad, but the reality of the situation is we've got empty hospitals and bored healthcare workers and people sitting at home who would rather be working in an open economy, maybe with masks to minimize your potential to infect other people, right? And wearing it knowing that, yeah, it may increase you touching your face a little bit to take off the mask, but if you wash your hands first, it's no problem, right? We're humans after all. We're social creatures, and living in our houses, cowering in this tree, is not a solution to this problem. It is not. It is the absence of a plan. This government is not telling us the truth consistently and behaving on bad science at best. I mean, really? Less than 2 weeks? Like that, right? Oh, yeah, wear a mask. Sorry about that. We made a mistake. How many people died? Yeah, a lot more than some other countries. What did they know that we didn't act on? What did we know that we didn't act on because of misinformation? And why are we not holding people accountable? Right? I don't know. These questions I don't have answers for. Thanks for watching, everybody. Check out CanadaPoly.com, check out CanadaReport.co, and have a wonderful, wonderful day.